This is part 2 of our body composition and application audio lecture. Body composition in children and adolescents can predict cardiometabolic diseases and premature mortality. It can also be used for early interventions. Skin fold equations have correlated well with DEXA scans looking at bone mineral density. Can you think of any other methods that may be appropriate for children and adolescents? As we've seen, there are a lot of different ways to collect and interpret our body fat percentage estimates. There can be a trifecta of complications: the lack of established and accepted universal standards for body fat when we're trying to extrapolate this to different populations is the biggest issue or complaint. So we can have a lot of tools to know what our body fat percentages are, but then how we use that data can be problematic. When we're talking about minimum body fat percentages, females need to have a minimum body fat percentage of 12%. If they have less than 12%, this can cause hormonal changes and lead to the absence of menses. This can put them at higher risks for things like female athlete triad, which is usually loss of menses, disordered eating, and low bone mineral density or osteoporosis or osteopenia. For our males, the absolute minimum we could have is 3%. And that's because if we go below 3%, males can lose internal organ protective padding. So we need a base layer of visceral fat to protect our internal organs. When we're looking at different methods for body fat percentages, all the methods have a standardized error associated with them. Skin folds have approximately 3 to 5% error when we're comparing the skin fold measurements to the hydrostatic weighing. However, we also know that hydrostatic weighing has its own error, so that 3 to 5% of skin fold could be as high as 8 to 10%. There's no universal accepted criterion method. So as of right now, hydrostatic weighing is still considered the gold standard, but like we've talked about previously, there is some error associated with that. The only differentiating factor when we're talking about body fat percentages and minimums is gender. Again, females should not be below 12%. These next few slides are going to be discussing how to perform skin fold measurements. These are really important to review because we will be doing skin fold measurements in our lab later this week. So there are a bunch of different skin fold measurement options. We are going to use the ACSM sites, which is a 7-site skin fold measurement system. The measurements that we're going to take are abdominal, triceps, chest or pectoral, mid-axillary, subscapular, suprailiac, and thigh. Before we're actually pinching the skin, we have to mark the sites. So this slide is going to be good to reference. So to mark the site, we're always going to mark on the right side of the body using a line in the direction of the pinch. On each of the following slides, it'll tell you which direction the pinch is going to be. We also want a line perpendicular to the direction of the pinch. The perpendicular line is going to be where you're holding the calipers when you do the pinch. When you're going to pinch the skin, first you take your hand and you pinch the skin itself at the site and place the calipers approximately 1 centimeter underneath the pinch of your fingers. Do not let go of the skin that you are pinching with your fingers. It will really hurt your patient if you're just holding their skin with the calipers. You don't want to snap the calipers off the skin either or pull them off. You want to open and release them with the mechanism. You're going to go through each measurement 3 times, rotating sites. This allows the skin to regain normal thickness and texture. So what that means is you're going to go tricep, abdominal, etc. You're going to take one measurement of each site before you take a second measurement of any site. Okay. If your initial measurements are not within 1 millimeter of each other, then you need to retest. You need to take 3 new measurements at that site. Okay, so again, we're going to mark the sites using a pen. Then we're going to, and we'll talk about on the future slides how we do that. Then you pinch the skin. Then you apply the calipers just underneath your pinched skin while still maintaining the pinch. Look at the measurement, release the calipers, release the skin. So when we're pinching the skin, that's considered the direction of the fold, or the direction that the skin is being pinched. So the calipers will be perpendicular to the pinch. We have some vertical folds and some diagonal folds. So our vertical folds are going to be for our abdominal, tricep, mid-axillary, and thigh measurements. And our diagonal folds are going to be our chest/pectoral, subscap, and suprailiac. The first skin fold measurement we're going to talk about is our abdominal. So the abdominal is going to be a vertical fold. It's going to be 5 centimeters to the right of the umbilicus on the right side of the body. Remember, this is the patient's right, not your right. So you're going to have the patient stand. You're going to take your tape measure. You're going to measure from the umbilicus, put the 0 at the umbilicus, and then measure 5 centimeters to the right. That's where you're going to draw your vertical line, and then you're going to draw a horizontal line. Do not put the calipers in the belly button, okay? That is very uncomfortable for everybody. So what you're going to do is, if we can look at our bottom picture, you're going to pinch, and then you're going to apply the calipers. Make sure the calipers are perpendicular to the pinch. The next fold is going to be our triceps. So that's another vertical fold. So where we're going to put our line is we're going to be at the midpoint of the posterior side of the triceps. So we're going to first find the acromion process, and then you're going to find the olecranon, and you're going to take your tape measure and measure from the acromion to the olecranon with the arm relaxed at their side, and then you're going to find the midpoint. So if the measurement was 15 centimeters, then you would make the mark at 7.5 centimeters. Okay, and then as you can see on the right, they're pinching the skin vertically, and then they have that perpendicular line just underneath the fingers where they're applying the skin fold calipers. For this picture, the calipers are being applied at a little bit of an angle just so you can see it a little bit easier, but they should be perpendicular to the body. The next measurement we're going to take is our pectoral or our chest measurement. This is going to be a diagonal fold. It's going to be a little bit different if your client or patient is a male versus a female. So if it's a male, it's going to be taking the measurement, marking at half the distance between the axillary line and the nipple. So from the line of the armpit to the nipple, if you can see on the tape measure of the male, they've marked, and that one line is on the diagonal. That's going to indicate the pinch of the skin, and then they have a perpendicular line. Our technique is not the best in our female illustration, but we're going to be in the upper third of the distance between the axilla and the nipple. We don't want to expose the nipple, but we can kind of guess where that upper third is, and it's still going to be a diagonal fold. And then you can see we're pinching on that diagonal, and then our calipers are perpendicular. Our mid-axillary is going to be next. In the top picture, it's indicated by our circle. So that's going to be a vertical fold at the mid-axillary line. So we're going to have your patient identify their xiphoid process of their sternum, or if it's on a male, you might be able to see it. And then you're going to go laterally so that you're kind of underneath the armpit on that mid-axilla. And so our vertical line is going to be in alignment with the xiphoid process, and then we've got our perpendicular line. Okay, so remember a vertical fold for this one for both genders. Our subscapular fold is going to be a diagonal. So we're going to need to find the inferior angle of the scapula. So the easiest way to find your patient's inferior angle is to have them place their hand on the small of their back. That's going to expose their scapula a little bit more. You're going to find that bottom corner of the scapula, and then you're going to measure 2 centimeters away from towards the medial side of that inferior angle. But remember, it is a diagonal fold. So our first line is going to be on that diagonal angle, and then we're going to have our horizontal line to indicate where our skin fold calipers go. Our suprailiac is also going to be a diagonal fold. So this is going to be in line with the natural angle of the iliac crest. So you're going to find your patient's iliac crest, and then in the anterior, so anterior means front, axillary line, immediately above the iliac crest, you're going to make your diagonal line and then your horizontal line. The horizontal or perpendicular line is important because that keeps us and ensures that we're applying the calipers at the same spot between each trial. Because remember, we're going to cycle through these different positions. The last of our sites is going to be the thigh. So for our thigh, it's going to be a vertical fold. We're looking anterior midline of the thigh. So you're going to find the proximal border of the patella. So the border of your patella above the knee joint, and then the inguinal crease. You're going to measure that and then take the middle measurement. That's where your vertical line is going to go, and then your horizontal line is going to bisect it. In this picture on the right, the sketched picture was the best I could find. The patient's knee is bent. When we're taking the measurement, we do want their knee extended. Some additional information about body fat composition with skin folds. This is very common for wrestling. For the IHSA, or Illinois High School Association, the sites that are utilized for wrestlers for males are their triceps, subscapular, and abdominal measurements, and for females, they just use the triceps and the subscapular. When doing body fat composition testing for IHSA wrestling, the athlete must have a urine-specific gravity between 1.0 and 1.020 prior to taking skin folds. So the patient has to urinate in a cup, and then different devices exist. You could use a digital refractometer, an optical refractometer, or there are urine-specific gravities like test strips. And so you need to measure the specific gravity of their urine to ensure hydration. As we talked about before, the elasticity of the skin can change a little bit based on their hydration status. The other thing with our athletes that are trying to cut weight is a lot of times they'll be trying to cut water weight. And so we want to make sure that they're at an accurate weight before we're making recommendations in terms of cutting weight. When testing for the IHSA, you take 3 measurements at each site, and if they differ more than 1 millimeter, you need to wait 20 minutes and then retest. The person that is taking the data needs to be certified ahead of time, but anybody is eligible to be certified, and then they put the data into a program called Track Wrestling, and their software will calculate the body fat percentages. The only thing with certification is that if you are a high school wrestling coach, you are not allowed to certify your own athletes. But if you coach a different sport or you're the athletic trainer at that school, you are eligible to test your own athletes. It's just a conflict of interest for the coach that is coaching those athletes to also certify them.